conference is being recorded, and if you require any further assistance, please press *0. I would like to hand over the call over the conference to your speaker today, Mr. Michael Schumer. Go ahead, sir.
Thanks for joining us for the COVID-19 media briefing for February 24th. We'll start today with opening comments from Health Commissioner Jan Malcolm, Infectious Disease Director KRIS EHRESMANN, and MDH Assistant Commissioner Dan Huff. We'll then open up for questions from reporters. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. I have a very brief report today. We had an additional 761 laboratory-confirmed cases reported this morning, bringing us to a new total of 480,845 total cases since the start of the pandemic. And those, again, as always, are just the laboratory-confirmed cases. We know there have been many more that have never been diagnosed. Minnesota had another 9 COVID-19 deaths reported, announced this morning, reported yesterday, for a new total of 6,443 of our fellow Minnesotans who have lost their lives to COVID-19. There are currently 292 people in the hospital in Minnesota with COVID-19. Of those, 59 are in intensive care. On the vaccine front, we now have had over 1,140,000 total vaccine doses administered to Minnesotans as of 2 days ago, as shown on our dashboard. This is a total of both first and second doses. The number of people who've had at least one dose is now over 770,000 Minnesotans. 370,000 of those have now had both shots, and so have a complete series, and reminding people that it does take a full 2 weeks after the second shot for full immunity to have been built up. And with that, I'm going to turn it over to KRIS EHRESMANN.
Thank you, Commissioner. I just wanted to share some more news on the vaccine front, which is very positive. We have more good news with reports that the federal review of the Johnson & Johnson vaccine found that it was safe and effective. So we are looking to the formal authorization that will come. The Vaccine and Related Biologic Products Advisory Committee of the FDA is meeting on Friday of this week, and they will make a recommendation to the FDA. And so we expect that there should be FDA approval or authorization at the end of this week, and then the Advisory Committee on Immunization Practices that makes the formal federal recommendation for the vaccine, they are meeting on Sunday and Monday of this week. So we expect that they should have a formal recommendation for the Johnson & Johnson vaccine, which is really exciting. We are not sure exactly when vaccine could start arriving in Minnesota, but we expect that it should be in the short term. The fact that this is highly effective and a single-dose vaccine is significant. It also has less stringent storage and handling requirements, so that is positive as well. And as these decisions are made, we will be sharing more information with you in the days ahead. But certainly more positive news on the vaccine front. And I will turn it over to Assistant Commissioner Huff.
Thank you, KRIS, and that is exciting news on the vaccine front. I want to take some time today to provide an update on COVID-19 testing. Minnesotans continue to enjoy the best testing infrastructure in the country. There is no other state that has made COVID testing more accessible. We now have more than 20 community sites across the state, which is in addition to our Test at Home program, making testing available to anyone from the comfort of their home. And of course, our robust network of hospitals and clinics across the state. Testing positivity is going down across our state. In early November, positivity peaked at 15.6%. Today, that rate is down to 3.7%, a number worth celebrating. This progress is because of the sacrifices Minnesotans have made. Limiting the spread of the virus means fewer cases, fewer hospitalizations, and fewer deaths. But we're now beginning to see cases pick up again in some portions of our state. Over the past month, northwest Minnesota and south central Minnesota have begun experiencing an increase in case growth. West Central is also beginning to trend upwards. These are the same regions that were harbingers of the case increase last fall. Now, statewide, our decline in numbers has slowed. We must remain vigilant to avoid another wave. Vaccinations are coming and continue to increase, and that is fantastic news. But we are not there yet. We don't have enough vaccines in arms to stop the next wave of cases. Last week, as he announced the progress we're making in moving back to in-person learning, Governor Walz called upon Minnesotans to buckle down for the next 90 days and focus on our mitigation measures. He asked people to remember the basics: wear a mask, social distance, wash our hands, and stay home if we're sick. And of course, to get tested. Even if you have not bought into these strategies before, we are asking Minnesotans to give them a try for the next 90 days. We have it within our power to stamp out COVID in our state, allow for schools, businesses, and entertainment to open and stay open. As long as there are still cases of COVID-19 in the state, we need to remain vigilant and we need to keep testing. That's why the state continues to expand its successful mitigation testing program for child care providers and for our educators. In November, we launched a pilot program to provide on-site testing for our child care providers. It's an optional program, and it was meant to be a screening strategy for limiting the spread of the virus in our early care and education programs. This week, we extended this program through June for more than 180 programs that have been voluntarily participating. Child care providers have been on the front line since the beginning of this pandemic. They've come to work every single day, risking virus exposure to care for and educate our youngest Minnesotans and to support our community's needs. And even as child care providers continue to receive the vaccine, we continue to offer this important testing. The same is true at our schools. Even as we vaccinate our educators and school staff, regular testing of our educators continues. More than 1,700 school buildings are now registered for the educator testing program, representing public, private, charter, and tribal schools. And we have administered more than 72,000 tests to educators. And fortunately, our positivity rate has been 0.35%. COVID-19 testing remains an important tool for limiting disease impacts and ending the pandemic as quickly as possible. It's how we preserve the great progress we've made. And that's why today we're launching a new campaign focused on testing for young people. We're asking families to get tested every 2 weeks from now until the end of the school year. The number of students attending in-person classes continues to increase, with thousands more expected to return to the classroom in coming weeks. Children and young adults are resuming youth sports and other activities. This is all fantastic news. To protect this progress, we need to use all the tools at our disposal. Just as our educators and child care providers continue to get tested, we're asking parents to do the same and make regular testing a priority for their families. Testing can help spot a single case early and prevent it from becoming many cases. We'll be reaching out and providing a range of online resources for schools and youth organizations that they can help send to families to encourage testing. We're also updating our testing resources to make testing for families easier to do, both at our community testing sites and through the Test at Home program. Now, this is not a requirement. We're not asking schools or youth organizations to provide this testing. This is a recommendation for all youth in person, returning to school, youth sports, extracurricular activities, to get tested every 2 weeks through the end of the school year using the robust statewide testing infrastructure that we have created. Regular COVID-19 testing complements other safety measures already in place, such as masking and social distancing. I know people may feel exhausted and tired of all of this. The masking, the testing, missing their loved ones and friends. But we're asking people to help us protect the progress we've made. We want our schools to be successful, just as we want our economy to be successful. We want to let kids play softball and chess, act in the school play, and participate in the debate team. We can do this together through testing, masking, and social distancing. Thank you. Commissioner Malcolm, I'll turn it back to you.
Thanks very much, Dan. An important reminder of the role that testing will continue to play in making sure that we can catch cases when they do appear and help to contain them so that we can sustain this progress going forward. Thank you, Dan. Mike, back to you for questions.
All right, thank you, Commissioner. Operator, we're ready to take questions.
All right, at this time, I would like to remind everyone, in order to ask a question, press *1, then the *1 on your telephone keypad. Okay, so we have your first question coming from the line of Catherine from Minnesota Public Radio. Go ahead, ma'am, your line is open.
Yeah, sure. So just to get some more detail about this testing strategy for kids in schools, my first question is this something that families are expected to do on their own, or will there be testing resources in schools? And then secondly, like, which tests are you encouraging people to use? I mean, are we supposed to go to sites every few weeks, or what does that look like?
Dan, will you take that?
Yes, Commissioner. Thanks for the question. What we are asking is for parents to either use the Testing at Home program and order the online saliva kits for their family, or go to one of our community testing sites or work with their healthcare provider to arrange testing for their family. We are not asking schools to take on this additional testing burden. We are so thankful for all that schools are doing in this difficult time to make sure that both teachers and educators and kids are all safe. So we're asking for parents to do this as a way to both protect your kids, but also protect their teachers, their coaches, as well as the other family members that they will be interacting with.
Okay, and just to follow up, Chris, on the Johnson & Johnson vaccine, where do you envision this vaccine going once you have it? Like, where is it going to be most effective in terms of its, that one dose situation and it not having some of the stricter storage requirements that the Pfizer vaccine has?
Thank you. Well, I think we'll be looking at situations in which we think that particular populations may not be as likely to come back for a second dose. So what are the populations that would really benefit from having just a single dose as a means for protection? Certainly the storage and handling means that it can be distributed widely for providers that don't have access to the very stringent storage that is necessary for the Pfizer at this time. But that's what we're looking at is certainly as more vaccine becomes available from Johnson & Johnson, it'll be a vaccine that really anyone can access, but certainly in those situations in which we know that certain populations will have greater difficulty in returning for a second dose, this would be the perfect vaccine.
Thank you.
Thank you. The next question comes from the line of Theo from Fox 9. Go ahead. Your line is open.
Hi. The White House officials said on their briefing this morning that they would be sending 3 to 4 million Johnson & Johnson shots out next week. I think we can all do the math on Minnesota's 1.69% share of that, unless the two of you know something different. I'm also wondering, what did the White House say last night on the call as far as next week's allotment of Pfizer and Moderna for Minnesota?
Well, I can tell you that we don't. The White House has been telling us that we will be getting additional vaccine, and that has happened over the last number of weeks. But until Tuesday happens and we get the actual allocation, we don't have projections, and they've had greater difficulty in projecting the number of doses that each state will receive. But as I said, we have continued to get increases in our allocations. And certainly for the Johnson & Johnson, that's wonderful news. That is just more doses that we can get into the waiting arms of eager Minnesotans. So we will look forward to when that becomes part of our allocation.
And just to follow up on your last comment about targeting the J&J shot to populations that are less likely to come back for a second dose, are you talking about people with disabilities, people with transportation, lacking transportation? Can you give us some specifics there?
Certainly, I can give some examples. I do want to be clear, however, that this vaccine will be used for any Minnesotan, but just as the commissioner and I have talked about, over the last weeks, we have a really wide-ranging vaccine ecosystem in Minnesota, so lots of providers providing vaccines in lots of different settings. And so there will be some settings where this type of vaccine may be a better fit, but certainly we will be using this across the board. But for instance, if you were doing outreach to, say, a homeless population, or as you said, if you are doing work with populations that have difficulty obtaining transportation, and so you're providing vaccine clinics, that this would be a great vaccine in those situations. So we will make sure that we're trying to maximize the benefits of the vaccine to a particular population, but the vaccine will be used across the state. So we certainly won't be hanging on to it for certain populations. We will just continue to get vaccine out.
Okay, thank you.
Thank you. The next question comes from the line of KRIS from Pioneer Press. Go ahead. Your line is open.
Hi, thanks. I noticed at the end of your news release today regarding the school-age testing routinely, you noted that people who are working in schools and child care settings and other healthcare workers who are already vaccinated with both doses should continue to be tested routinely. And I was hoping you could talk a little bit more about why that is.
Chris, can you take that?
Oh, Chris, I'm sorry. I thought you were going down the testing, and so I was thinking Dan was going to answer. Can you just restate your question? I'm so sorry.
Sure, no problem at all. So I just noticed that you're recommending that teachers, healthcare workers, other folks that are in close contact with people who are already vaccinated still continue to get tested routinely. I was just sort of wondering why that is.
Oh, okay. I'm sorry. Just because I think, as we have mentioned in the past, the original data that we had on the effectiveness of the vaccine really focused on clinical disease, and so we haven't had as much good information about asymptomatic disease. Again, that's not to say that we may not see protection from asymptomatic disease, but we are waiting for more and more data to come in on that. And so in the absence of that data, we want to make sure that we are picking up potential disease, particularly in environments with vulnerable populations like the healthcare setting, and then also in environments like a school setting where transmission could have obviously a real problematic impact on teaching and the classroom. So that is the reason why. And certainly as we learn more and get more information on how these vaccines protect against asymptomatic disease, we'll be able to modify our recommendations.
I know that there's some national research going on right now about whether or not people who are vaccinated can carry and still spread the virus. It sounds like that's some of the data you're trying to gather here. Is Minnesota participating in any of that national research?
Yes, there is ongoing evaluation for this. Our request that these individuals continue to get tested is not part of any sort of public health research. It's just a public health disease prevention strategy. So there is ongoing evaluation of this across the country, but the request that we're making is not a research request. It is simply a means to control disease.
Thanks so much, Chris.
All right, thank you. The next question comes from the line of Joe from Sahan Journal. Go ahead, your line is open.
Yeah, hi, thanks. My question is about the vaccine connector and some concerns I've been hearing from people who speak English not completely proficiently and people as a second language. I'm expressing concerns to me that the connector itself is not offered in English or is only offered in English, and that some of the questions in it are a bit complex for people who may have limited English skills. So I know that there's a hotline that Somali and Hmong and Spanish speakers can call in. But I'm curious if there's any other kind of movements MDH is working on to make the vaccine connector itself more accessible for non-English speaking residents.
Well, this is Jan. Thanks, Joe. You're right. I think we at this point in time are relying on translation assistance to help people navigate that connector. I would have to check with other colleagues to see what work might be going on to put the connector itself into different languages. Unless any of my colleagues on the phone happen to know that, we'll have to research that and get back to you.
Okay.
Thank you. The next question comes from the line of Alex from KTTC News Roster. Go ahead. Your line is open.
Thank you. Yes, here in South Central Minnesota, where we're located, we're having a lot of distrust with the vaccine, as well as people still not believing the pandemic is serious. As far as the Johnson & Johnson vaccine, how effective is that? And then as far as vaccines as a whole, have we heard of any negative reactions? Because we're still hearing people say horror stories of the vaccine. Do we have any stats or data to say that though that's only happened in 0.001, any adverse reaction data?
I'm going to turn that back to Chris, too. Thanks, Chris.
Yep. So the Johnson & Johnson vaccine is also a very effective vaccine. It is 72% effective at preventing moderate COVID, but when we look at preventing severe disease, it is 85% effective, and it is 100% effective against COVID-related hospitalization and death. So it is a very effective vaccine. The clinical trials show that protection was consistent from different geography. So the clinical trials were conducted in many places across the globe. So they saw the same the same effectiveness in those locations. They saw that effectiveness across various ages and also across various virus variants. So including the variant B135.1 that was originally observed in South Africa. So it's a single dose. It offers good protection. And I guess for folks that have expressed concern about vaccine safety, I just want to say that, first of all, these vaccines have gone through the same safety evaluations that any other vaccine that's been approved and licensed in the U.S. has gone through. The clinical trials were of the same size. And now that we've had millions of doses administered in the U.S., we have continued to see that same safety profile. So I think we've mentioned on previous calls that in addition to all the safety testing that occurs before a vaccine is authorized for use, there is ongoing post-authorization or post-licensure evaluation that continues. And so that has been ongoing with both the Pfizer and Moderna vaccine. And what we've seen is with millions of doses administered, the safety profile has been consistent with what was seen with the clinical trials, which is a very good safety profile. So for the folks that have expressed some concerns about the vaccine, I think that there's much positive information to share with them. And I think that was those were both of your questions. If I missed one, just let me know.
Yes, I guess the only other thing I would add is some people, you mentioned the other vaccines. Some people just don't believe in vaccines at all, these anti-vaxxers. We even have some billboards by anti-vaccine groups here in Rochester, the Med City, believe it or not. And do we have any data? Have there been any deaths caused from the vaccine, or is it completely harmless? I guess that's what people's biggest concern is.
Yes, well, certainly, as I said, with the post-approval evaluation, any death in a person who received vaccine is being investigated. What I need to do to put it in context is that our first vaccination has been occurring in our most vulnerable population, so our elders. And so, yes, there have been some deaths that have occurred after an individual is vaccinated, but and they are all being investigated at the federal level. But at this time, there is no evidence to suggest that any of those deaths were vaccine related. In other words, there are a number of deaths in Minnesota every day that we expect that will occur in our elder population. And what we're seeing appears to be consistent with that and does not appear to be related to the vaccine. But as I said, there are formal evaluations that will also be happening.
Thank you. Operator, we have time for one more question.
Thank you. Okay, we have the last question will come from the line of Glenn from Star Tribune. Go ahead. Your line is open.
Hi, thank you. On the testing of students and the families, have you done some kind of calculation on what this will do to daily testing volume? And especially, will it create a backlog in the home testing processing?
Dan, are you still on?
Happy to take that. Yep, I am.
Thanks.
Yeah, no, that's a great question. We I guess impact on how many people would get tested that remains to be seen. We hope that every that parents and guardians will take their children and get tested. We have built the infrastructure so that we can handle the demand. You will remember that back when we first launched the Test at Home program, it was wildly popular. We overwhelmed UPS, and we worked with UPS, the U.S. Postal Service. They're now ready to handle what we throw at them. We have the test kits ready, so we are ready to handle the demand, whether it be at one of our community testing sites or through the mail order program. We have plenty of capacity. Thank you.
Okay, and is there any about why every 2 weeks?
Well, yes. 2 weeks is, it's a full incubation cycle. But also that provides a good regular testing schedule. It's the same schedule that we're doing with our educators and with our child care providers. With testing, as with other mitigation measures, the more frequently we do it, the more likely we are to catch cases. We feel that 2 weeks is a good point between being just too much for families, but also providing us a really good way of keeping tabs and making sure that we're keeping cases down and finding them early so we can prevent them from spreading.
Thank you.
All right, that is all the time we have for today. We invite any.
This has been a WDIO News Special Report.